now that I've started the recording, I will welcome everyone again to the Birds and BBV Bite, and I'll hand it over to Megan Roberts. Take it away, Megan.
Thanks, Bea. Thank you all for having me today. Before I begin, I would just like to acknowledge the traditional owners of the land on which I'm doing this presentation on today, the Whadjuk people of the Noongar Nation, and I pay my respects to elders past and present. So, as Bea mentioned, my name's Megan and I'm currently working at the School of Population Health at Curtin University as a research assistant with Siren. And in 2021, I completed my Masters of Public Health at Curtin Uni, and I'm here today to share with you some information about my dissertation project, which basically sought to understand client experiences of termination referral denial in Western Australia. So I'm going to give you a bit of a background on the lay of the land and why this project came about and why it's so important. And then I'm going to go through with you a little bit about how I conducted the research and what we found and what kind of things we want to advocate for to improve patient pathways for people trying to access terminations in WA. Just a really quick acknowledgement before I begin. I had a fantastic supervisor at Curtin, Dr. Jackie Hendricks. I have to say a huge thank you to her, and the lovely staff at SHQ helped a lot with this project. This kind of came out of their staff noticing that lots of people were being denied referrals, and kind of the project was originally put forward by them. So this is just a bit of background. So basically, the decision to terminate a pregnancy can be a really difficult process for many people. And health professionals like GPs play a really fundamental role in providing support and ensuring patients make safe and informed decisions. And this topic has been in the media a lot recently, so I'm really pleased that Veronica invited me to chat about it today, because it's really timely, because, you know, termination of pregnancy is kind of a morally contentious health issues, and there are some health professionals who refuse to participate in any part of the process kind of due to morality and conscience. So we have this term called conscientious objection. Basically, it refers to the refusal of health services due to ethical, religious or other beliefs. And this refusal kind of happens in other areas of reproductive health care a little bit as well, around kind of contraception and that, but not so much. It's most prevalent in the refusal to provide or refer for abortion services. So this refusal has kind of been documented in lots of different countries around the world. But despite this, there are lots of gaps in the research, particularly within an Australian context. Research around abortion rights, stigma, access, etc., there's not much of it around what's happening in Australia. So we really do need more research to establish good strategies and recommendations that help people get timely and efficient access to abortion services. So a little bit about the law and how it linked in with my project. So as we probably know from what we're hearing in the media at the moment, but policies and laws around access to termination services vary across Australian states and territories. Every state and territory is different around how you access it, where you can get it, the gestation time, that's the maximum gestation time that you can have an abortion. But in WA, it's a legal requirement for people to get a referral from a medical practitioner in order to be eligible for a termination. So basically what this means is that any person wanting to access abortion services in WA need two doctors to be part of the process. One is the referring doctor, so your GP that you go to and say, hey, I'd like a referral for an abortion. And then the second doctor is the doctor that actually provides the termination service. So either prescribing medication for a medical termination or actually undergoing the surgical abortion procedure. And then alongside this, it's really important to note that GPs in WA actually have no legal obligation to participate in a consultation or provide referrals for termination services. So a woman or a person can go to a GP and say, this is what I want, and the GP is, you know, it's legally within their right for them to say no. So with all this in mind, the aim of my study was to document and understand client experiences of being denied a referral by a GP for a termination in WA. And I did this from the perspective of service providers. So originally, when I embarked on this project, I really wanted to capture the first-hand experiences of people who had recently been denied a referral themselves. But we had lots of posters put out, and unfortunately there was just a really low number of people who wanted to participate, which kind of says something perhaps around the stigma around this topic. So we changed our kind of project slightly to service providers. So this includes people working at a termination clinic in Perth, and I spoke to those staff members working at those clinics to get their thoughts and feedback on the process, and it kind of gave them an opportunity to share their experiences and their stories with me around interactions with their patients and whether people had spoken to them about being denied a referral. So it was kind of a little bit of second-hand information in a way, because we couldn't get that first-hand experiences, but as you'll see as I go forward, the staff gave some amazing information and stories. So basically the objectives were to document the existence of this referral denial. We wanted to actually see if it was indeed happening, to understand the experiences of people, investigate client and service provider knowledge around the law, around termination, and then at the end to provide some recommendations regarding patient journey pathways and improve that pathway for people who are trying to access a termination. So the study used a qualitative approach. So this meant that I undertook some interviews and focus groups with service providers. So this was, as I mentioned, staff employed in either a clinical or an admin role at a service in Perth that provided terminations. And then after each of these interviews and focus groups, I analysed the data to identify some common themes. So overall, there were 16 staff members across 5 different clinics in Perth that participated in this study. They were mostly employed in a clinical role, so they were mostly nurses, doctors or midwives. There were a couple of other participants who were employed as a counsellor and a medical receptionist. And most of these staff members had been employed at their clinic for more than 5 years, so they were really able to give us a lot of great context around what was happening at their clinic and the people that they were speaking to. And we did 2 focus groups and 9 interviews. So after all these interviews and focus groups were conducted, I analysed the data, and the data revealed 4 main themes, which were client stories, abortion stigma, patient pathways and workforce. So I'm going to go through these one by one and just tell you a little bit about each of these themes. So the first one is client stories. So all the 16 staff members that I spoke to shared numerous stories told by their clients and patients over the years. Every single participant reported to me that at some point in their current place of employment, clients had reported to them that they'd been denied a referral for an abortion. So this meets our objective of confirming whether or not this referral denial does actually exist. Every single staff member said that at some point someone had mentioned to them that they hadn't been able to get a referral when they wanted to. Overwhelmingly, the stories and experiences of these clients were quite negative. This included, things like needing to see multiple GPs, being charged for their appointments despite not receiving a referral, being sent off for unnecessary tests, and even some people saying that their doctors were kind of giving them misinformation. Things like, you know, if you get an abortion, that will increase your risk of breast cancer, and all these other kind of myths and misinformation that wasn't factual information that they should have been giving their patients. A common experience by over half of participants said that patients they'd seen had this thing called doctor shopping, which is where they were seeing multiple GPs before finding one who would give them a referral, which can be really time consuming. And as many of you would know, abortion is it's a time sensitive procedure, and in WA, it's 20 weeks is the maximum gestation that a person that can get a termination. After 20 weeks, their case has to go to a board of about 4 health professionals at King Eddie's, who then have to determine whether the risk of harm to the mother or baby are enough that it warrants them approving an abortion. So it's a time sensitive thing, and when you're being denied again and again and again, you're going to so many different GPs, it can be really exhausting for people, and it can cost them a lot of money if they're not going to bulk billing doctors as well. So the people I spoke to, the staff, spoke about the impact of this and how being denied a referral for a wanted abortion, it does add to the trauma of a really difficult situation. And participants spoke about how clients often seemed angry, upset and frustrated in response to the denial. And lots of them felt quite humiliated and embarrassed as a result of being denied this requested service. Participants were also asked whether they thought their patients were aware of the legal requirements in WA to obtain a referral by GP. And 10 people said that based on their experience, their patients generally were not aware of this. I think people just tend to go to their doctor as a first point of call because they probably aren't aware of where these termination services are in Perth. And so if you've got a family GP or a GP you're really comfortable with, that is that first place that you go to find out what next and what are my options. So the second theme was abortion stigma, which I'm sure doesn't come as a huge surprise to a lot of us, but there was agreement amongst almost every participant that abortion stigma exists in both the general public, but also within the medical community. So when people were talking about stigma in the general community, many participants spoke about how their clients were really concerned that information relating to their abortion, such as like their Medicare receipts, would somehow get back to their GP. And they would tell stories of clients who requested that all paper trails related to their procedure were destroyed, or even going so far as to pay for their abortion with cash just to avoid using their Medicare card because they were so afraid that this information would get back to their GP and would get to their family or their friends somehow. So they were really scared about, you know, any paper trail related to the procedure. And then this lack of knowledge around abortion legislation and procedures was also thought to have been a result of stigma. And then people spoke about stigma being evident within the medical community as well. So obviously most of the staff I spoke to were members of the medical community. They were either doctors, nurses or midwives. And 8 people talked about the anxiety and concern that exists amongst GPs who provide termination referrals or are providers of medical termination of pregnancy. So for those that aren't familiar with that, there is some medication that people can take to have an abortion within the first 9 weeks of pregnancy, and GPs can become prescribers of this medication, which means that the woman doesn't have to undergo an anaesthetic, they don't have to have the surgical procedure done, and they can take this medication at home and have a termination at home. But you're only eligible if you're kind of under 9 weeks gestation. So it's right at the beginning of pregnancy if that's an option for people. But the staff spoke to me about how a lot of GPs who do prescribe medical termination of pregnancy drugs. They're really fearful and reluctant to promote themselves as MTOP providers. And it's resulted in many people calling them the silent prescribers. So they're not advertising to people that, you know, this is a service I offer. It's just something that if it comes up, they'll offer it. But the public don't know where to go for this a lot of the time. So this is a quote from one person who said, "But it remains to this day the silent prescribers. Doctors don't advertise that they will prescribe for medical terminations. And again, I think it's that fear that they're going to get people protesting or sort of negative publicity from pro-lifers." So it really comes around that fear that's so inherent in so many people. And we know it exists in doctors and nurses a little bit as well, that they're going to get negative publicity. They're going to get people, you know, picketing and protesting out the front of their clinic, which we know doesn't really happen that much. And we have safe access laws now, which means that those people protesting out the front of abortion clinics can't actually do that anymore. So, but this study did, this was before those laws came into play. So I guess that fear was a little bit more in your face. The third theme was patient pathways, and this referred to both the suggestions and barriers to improving patient journey. So there were lots of suggestions from the staff members. The main one that I want to talk about is the implementation of policies for GPs who don't provide referrals, because as I mentioned, they're not legally bound to that. They don't have to if they don't want to, but policies around those who don't want to provide a referral, that they must refer people to someone who will. So that's a really important one, because it's actually a law that exists in Victoria at the moment where, yeah, if you're a GP and you don't want to give referrals for an abortion, but you must refer that patient onto someone who will. And I think that would make, you'd like to think that would make a really big difference in people not having to do that doctor shopping and go around to so many GPs before they can find one who will give them their referral. Other suggestions included having a public list made available of online GPs and clinics who provide referrals, perhaps more comprehensive GP education around termination processes and legislation and stigma, more community education that empowers people to talk about this issue and share information, and then encouraging more GPs to actually become prescribers of medical termination of pregnancy and promote that to people in a way that, you know, is appropriate to where they work, but so that people know that if they wanted to access medical termination services, they can, and they know where to go. So despite all of this, there was a sense amongst staff that improving these pathways wouldn't be easy. Barriers that we spoke about included, you know, GP concerns about protesters and backlash, a lack of GP knowledge and understanding, and a reluctance by GPs to actually receive abortion education. There was a sense that those who wanted to be educated in this topic are probably those that already know quite a bit about it, and the GPs that really needed it wouldn't be the ones that access it. So yeah, it's a little bit tricky, but something to think about. And then the last theme was workforce. So this was a chance for the staff I spoke to share their own experience working at a termination clinic and share their personal attitudes and perceptions on the topic of termination referral denial. So some people said this whole thing made them feel really angry and frustrated, especially when they heard that clients were charged for their consults and not referred on to someone else. Other participants felt that their anger came from the often judgmental nature of referral denial and just that lack of respect for patients' decisions and, you know, autonomy over their bodies. Lots of people said they felt GPs really have an obligation to do everything they can to support their patients and to always be non-judgmental. And the fact that abortion is an essential service that no one should be denied access to. And these feelings were reflected in the support that these staff members provided to their clients which was really around ensuring everyone was treated with respect and can access the care and support they need. And it was really clear to me that everyone I spoke to was so passionate about their work, and they really enjoyed helping people access safe and non-judgmental termination services. People spoke to me a lot about the fulfillment they received from the work they did, and the positive feedback they'd often get from clients, and that was really a driving factor for the work that they did. And this was a really lovely quote that I had in my research, which was from one of the participants, who said, "It is one of the best jobs in the world to feel that we are really helping women through one of the most difficult days of their lives. And if you can just make it a little bit better for them, I do feel good when I go home." I thought that was a really lovely end to all the themes. And yeah, it was really nice to hear how much the staff enjoyed helping people and work with people in this space. So at the end of all this, these are the main recommendations. The big one is to advocate for mandatory on-referral policies for GPs in WA. So as I mentioned, this would mean that even if a GP does not wish to refer a patient for an abortion, they are obligated to on-refer to someone who will. Other recommendations include having a list of public GPs, which I mentioned before, just as a way of simplifying that patient journey, and so people can kind of know where to go from the start of this process. Having more education on termination procedures and legislation, and yeah, trying to increase the number of GPs who become prescribers of MTOP, which is the medical termination of pregnancy. Which I think would really better meet the needs of clients seeking termination services in those first 9 weeks of gestation. And these are a couple other quotes from people supporting that commonly mentioned recommendation around on-referral policies. So one of the nurses said they ought to have a legal responsibility to find someone on that day who will give the referral. And then one of the GPs I spoke to said, because as a GP, you don't have to provide termination, obviously, but you should at least refer on to someone who can. And that is the end. Thank you so much, everyone, for listening. I'm going to try and maybe stop sharing so that I can see everyone's faces again, and we can have a bit of a chat.
Thank you, Megan.
Thank you.
That's so interesting.
I'm glad.
Yeah.
Hopefully I didn't rush through that too quickly. I was just looking at the time.
No. Does anybody have any questions for Megan or comments? If you want to put it in the chat bar, we'd love to see your face if you have a question.
I have a question.
Hello, Joe.
Hi, hello, how are you? I just wanted to know about any, did you have any data on, I guess, like maybe trans people, specifically trans men who have been looking for termination of pregnancy? Any data around that?
No, that wasn't brought up at all, actually. I guess because we wanted to know more about the experiences relating specifically to that referral denial, regardless of someone's gender identity. But yeah, that didn't actually come up. But I'm aware that, this topic is so under-researched, and research around trans people's access to health services is also something that's incredibly under-researched and really difficult. But yeah, it's definitely an opportunity for something that could happen more in this space, because the judgment.
We'd love to see the research there.
Yeah.
But it's just the complete denial. I feel like clinicians completely deny that, and like, of course, trans males have a complete denial of access to just contraceptive options in general, let alone termination of pregnancy. So it'll be very interesting to see, I guess, emerging research in that space. That's just my 2 cents. Thank you.
No, that's so important, and it's very true, because the judgment is there already with accessing terminations, let alone having that judgment as a patient who's a trans man as well. It just kind of would compound it, I'm sure.
Absolutely. Megan, Daniel just said, do you want to talk about some of the advocacy you've been doing and some of the talks about reforms? that are happening?
Yes. So to do some shameless self-promotion, there was an article that my supervisor Jackie and I wrote recently that was today published in the Medical Forum magazine, which is all around my research and advocating for the mandatory on-referral policies. And there is stuff happening in this space that, yes, I can definitely give you a link to that. And yeah, it is something that is getting traction with everything that's happening in the US over the last few months. You know, this is something that's been in the media a heap over the last month or two. But there's also some work that there was an article that Daniel shared as well with me recently that the ABC shared around Simone McGurk, you know, wanting these laws to be brought up to scratch, and that despite we were the first to remove the criminal penalties for pregnant patients seeking the procedure, but it's still in our criminal code, and there's a bunch of work that needs to be done around this now that we're reflecting on all the laws in each of the states. WA is kind of coming up not so good in comparison to some of the other states. So it's a bit of traction.
So yeah, Summer,
Yeah, sorry. I was just wondering, I might have missed it, but were you doing any research as well to see if this sort of discrepancy in access is different in rural and remote settings compared to metro?
Yeah, so I was actually having a little chat with V before this started about that, because my research was primarily focused in the Perth metro area. We were only talking to staff at clinics here, but they did speak to me about people who lived in rural and remote areas that would have to travel to Perth for an abortion, and that this barrier of having to see a doctor for a GP can be really tricky, because a lot of women coming from rural and remote areas were getting their referrals from a nurse practitioner. Arriving in Perth, let's say the procedure was at 2 o'clock, they'd go to the clinic and the clinic would say, this isn't valid, this isn't a valid referral, there was a bit of misinformation, so they'd have to kind of find someone to refer them on that day. And it just created an additional barrier. If you live remote, you're already traveling, you're possibly putting children that you already have in childcare, you're taking time off work, and then you've got to kind of find a GP to refer you amongst all of this. It just adds another barrier, and the staff did speak a little bit about that. But in terms of what's actually happening in the regions, I'm not too sure.
I can only sort of speak from my own experience as you know, working in a GP practice, that we had a young couple that, you know, drove 2.5 hours from the wheat belt to the metro area, and it was a young couple, and they had an 18-month-old baby, and mum was pregnant again. They were struggling. Dad was unemployed, and so they came to Perth and wanted to have a termination, and they were denied that termination at the practice. You know, were told that they could come back another day, but they'd actually, you know, driven on a day that was actually a weekend. So they actually had to go back home and then come back again during the week. And you know, again, that was just, and also too, I think it's the timing as well. Like if you wanted a medical termination of pregnancy and you were around the 8-week mark, your timing is so critical. Yeah. So, but yeah, so I guess, you know, I've sort of seen that firsthand experience and have seen the distress that causes. Yeah.
Yeah, it would be interesting to see like more data around it. But yeah, myself, from doing placements in rural towns, seeing the hospital being the sort of main go-to, and the hospital in the regions for a lot of our remote communities is at least an hour away. Like it's not a close by space.
Yeah. It's tricky. And also if you come to Perth not realising that you need a referral, that's the other thing that some of the staff mentioned, that people were travelling, as V said, you know, hours to get an abortion, thinking that they could just go to Murray Stopes and book in, which in every other state they could. But here you have to get this referral first. So then the staff at these clinics are kind of feeling really, you know, they're at a loss because you can't have a referral from the same place that is doing the procedure, they have to do it from a second doctor. It has to be 2 separate doctors. So it just adds complexities for the staff at these clinics because they're trying to think about where they can send these people to get that referral for that day. So yeah, it's tricky.
So Hannah's just written, it seems a bit morally questionable that GPs are still charging patients after refusing to provide a service. Would there be any capacity to require practices to bulk bill in these circumstances, in addition to having to refer to a willing doctor? I was thinking the same thing, Hannah, like in that, you know, that push for that policy, is it that, you know, those GPs that are not going to refer to a termination clinic but on to another doctor, that they shouldn't be charging?
Absolutely. Yeah, it's horrible. That was one of the worst things that come out from this, was these poor people that went to, one person shared a story of someone who went to 6 doctors before they found one that gave them a referral, and they were charged almost every single time for those appointments where they didn't actually get the service they requested, which is horrible. So it definitely should be something around, you know, bulk billing if you're not willing to provide that service.
Yeah.
Because it's just
because you're not
another
providing a
barrier.
service. Yeah.
Yeah, it's like anything where you pay for a service that you're not receiving. Yeah, it's not fair.
Oh, I feel like we could just talk and talk and talk about this, and maybe we will have a part 2 of this. But I'm mindful of there's is there any more questions from anybody out there, particularly in those regional areas? We would love to hear if you have any experiences from patients your end or anything. Joe says he would have argued with them. Absolutely ridiculous. Yeah. Way to go, Joe. We need you on our shoulder. Would love to have a part 2 bites in the future. All right. Well, Megan and I will work on that. It's 12:34. We've gone a bit over. I would like to thank everybody for joining us on this Birds and BBV Bite. The recording will be available on the AQUA website through our YouTube channel. It takes about a week to get up there, but it will be there if you would like to share this bite with your colleagues. Please do. And thanks again for joining us. The month of August is a bit of a pregnancy month. So next week we've got Sam Stubbs from our Tackling Indigenous Smoking team here at AQUA talking about smoking in pregnancy. And the week after we have Dr. Fua from MCDC who's going to talk about syphilis in pregnancy. So we do have a pregnancy theme happening. Megan, thank you again. It was really great. Your research has just been amazing that you've actually taken up and got some absolutely fantastic information from, even though it didn't work out, you got those stories from women or people themselves that have had a termination or wanted a termination. The practitioners can give so much and speak on behalf and advocate for their clients, for their patients. So I think you really captured some great information, and congratulations that it's gone on to the medical forum.
Thank you.
Hopefully we'll see some more changes in WA.
Yes, absolutely. Fingers crossed. Thank you so much for having me and for all your questions and engagement. It was lovely.
Great. All right. Thanks, everyone.
Thanks, guys.
Bye.